going to walk through a little bit regarding what our products are, why it matters to think about medical and specialty, and then 3, really what the real opportunity is from a group's perspective when we think of things, and I say things like whole case underwriting and the financial benefits to the group to have both medical and specialty benefits combined together. Now, a thing you're going to hear about in a little bit, the question I often get asked is, how can you guys, or why does UHC think about the real benefit of specialty and medical? The interesting thing that as we look at it, we're going to talk through, is that there is a true dynamic that is different when you have access to both the medical claims and I can outline every other specialty line that we touch. So you think about a long-term disability claim and how that can be influenced if a carrier had access to both the medical claims and the long-term disability claims. And if you think about, from a competitive perspective, when I think about those standalone LTD carriers, life carriers, who simply do not have access to medical claims, they have what they see and they have what they hear about and they have what the customer or the member tells them. Well, as a carrier that has all lines and access to all different components of a claim or individual, we can see it all, touch it all, hear it all, and really motivate and encourage the right care at the right time for the right reasons, with the whole effort, specifically at picking on LTD claims, about trying to get the member back to work. So if we can see that a member is non-compliant with either pharmacy or non-compliant with the treatment course, we have access to that. We don't have to wait or ask the member. We simply can look at the claim and say, and make an outreach call. So that's kind of the intro that I wanted to make tied to especially why the specialty discussion now. Janet and I have worked together for about 6, 7, 8 years. I don't know the exact number of years, but it's been a while. And Janet comes to us from Minneapolis, so she's at our main office, our national headquarters in Minneapolis. And Janet has multiple years of experience working with our marketplace in all case segments, in the 2 to 99 space as well as the 100+ space. So having her on the call is great. So she's going to take us through and lead us through the discussion tied to specialty and the why it matters. Why it matters is the key thing we're trying to get to with the discussion. Why does it matter for you guys to think about or care about UHC when it comes to specialty and medical? So Janet, are you ready to go?
I am. Can everyone see my screen?
Yeah, I think if you can put it in the presentation mode.
Okay. And I'm not sure.
Right down at the bottom, there's a little screen-like icon. Of course, I'm here. You can't see my mouse, I don't think, but go down right below your mouse. Right. Yep, you're close. Down on that toolbar. And
left
right.
to 70.
Right. Keep going to the right.
Okay.
Right there. There you go.
Perfect. Oh, excellent. Thank you.
Yep. And spacebar will advance it. And I'll turn it over to you. Go ahead.
Perfect. Thank you, everyone. Good morning. My name is Janet Litwin, and I'm the specialty sales consultant for UHC River Valley, as Mike mentioned. And I've worked with UHC for almost 8 years now. Prior to that, I worked at a local health plan, HMO here in Minneapolis, for about 12 years. So I've been in the healthcare industry about 20 total years, which is kind of hard to believe. Time goes so fast. But the real purpose of this training, as Mike mentioned, is to give you a great overview of our specialty products that we offer, to touch on our networks, kind of show you and share with you the years of experience that we have with each product line, and then go into some of the advantages that we have with our products, ancillary products, how we are different from other ancillary carriers, what makes us unique in the marketplace. And then just to start out, I would like to just touch on our mission and kind of our value story for you. Basically, as you probably already know, UHC's mission is to help people live healthier lives, and that's basically what our entire organization is all about. We're able to do this by bringing the power of information and innovation to our mutual clients, and we think that getting better information to our customers, helping them make better decisions, in turn leads to better health. And we have a lot of statistics to show that as well. and that ties right into our Bridge to Health program that we'll get into later in the training. Our UHC specialty value is basically built around the fact that we have one of the broadest product portfolios, simplified administration, and one account management team. We have innovative technology and integration, excellent customer service, financial strength and backing from United Health Group, and we're basically one of the top 10 specialty carriers, and with our Bridge to Health program, that really differentiates us from the other carriers. So our ability to integrate our dental, vision, and disability claims management with medical supports our mission to providing better information, which leads to better decisions and results in better health. So that's the powerful message we want to convey to you today, and that you can convey to the marketplace. Next slide.
Just hit your space bar. There we go.
Can you see the whole screen?
I got it.
Make sure everyone can see it. Okay. Basically, over 20 million people nationwide are covered by our wide range of products. Starting with dental, we service more than 7.5 million dental members from over 84,000 employer groups. We also, in our dental product line, we have over 25 years of experience in the dental industry. We have an excellent national network, including more than 90,000 unique providers and over 240,000 access points. So that results in very low disruption for customers changing carriers. For vision, we service more than 12 million vision members from over 36,000 employer groups, national network of more than 64,000 access points, which is just huge. We really are a leader in that, the fact that we have a national network. Our vision network has both private practice and retail chains, which also makes us unique, about 50-50. And on average, 99% of vision members in major markets have access to providers within 2 miles of their home, which is just excellent. We always get great feedback from our customers about that. We also have our own state-of-the-art eyewear manufacturing facility or lab located in Baltimore, Maryland. For financial protection, life and disability and FMLA, we service 1.2 million members from over 40,200 employer groups. We have over 25 years of experience in the life and disability industry, and critical illness and accident products are available in 49 states now. Those types of products are really a complement to our consumer-driven health plans, such as HSAs, because they provide financial protection for out-of-pocket expenses. Some of the key customer advantages with our specialty products include broad and connected products. We have a member-centered approach, so we're very consumer-centered with our specialty products, which makes it easier for our members to get their questions answered and for them to navigate through our system through our robust website and outstanding customer service. We have administration made simple, and with that, we have one billing system, one implementation process, an online portal called e-services, one account management team, and integration. With broad and connected products, the products can be purchased either individually or with the United Healthcare medical plan. And the products in our specialty portfolio include dental, both voluntary or employer paid, vision, critical illness and accident, and life and disability. We also offer actually FMLA services as well for specific size groups. The dental, all of these products are connected with our medical plans clinically and administratively. With the next slide talks about, which is a very exciting message to convey to you, is the dental and vision plans recently received a J.D. Power award for highest in customer satisfaction with vision and dental plans. it was just a fantastic message to our brokers, to our customers. Basically, the report measured vision and dental plan member satisfaction based on coverage, cost, communications, customer service, and reimbursement. And they looked at 4 vision plans, 7 dental plans, and the results were based on experiences and perceptions on customers surveyed from October to November 2014. So it just goes to show you we really have some fantastic plans with dental and vision and can really compete in that space as well. Member-centered approach. We absolutely, with our specialty products, have a member-centered approach, which speaks directly to our Bridge to Health program that we offer. We engage our members. We provide resources and support to them through this Bridge to Health program, and I'll get into more detail in a little bit on that. We can very much influence health outcomes with this program, increase access to benefits, decrease medical costs, reduce absence days, and improve productivity at work. Again, connecting specialty benefits with medical identifies additional opportunities for customers' engagement and better outcomes. And just to elaborate on that a little bit, which I probably will do quite a bit throughout this slide deck on the Bridge to Health program, since it does very much differentiate us from other carriers. What we do with this program, it really helps members cope with their illness, as well as return them to work faster and help reduce costs. What we do is we make outreach calls to the members. We evaluate the members' needs, and this is through a case manager who's trained specifically on the program. We can make referrals to appropriate programs and assist members and family members, and definitely get them to the right resources that they need to return them to work faster than normal. Next slide, we're just going to go through the different products in these next few slides. We also offer dental solutions, which is an important benefit that helps improve health and wellness, definitely. Proper dental care is an essential component for an employee's overall health. Our dental plans focus on prevention and include some great wellness features that help prevent complications from serious medical conditions. These features include oral cancer screening, prenatal dental care programs, disease management programs with targeted outreach, and wellness activation and behavior tracking. So we basically, with the dental, we really focus on the whole person and take a holistic approach. That's our whole basis for the Bridge to Health program again. And it's exciting because I think we've really made a difference with that program for the people who need it. We also, so again, with the Bridge to Health related to dental, we're identifying high-risk members and targeting them for outreach for the programs and the resources they need. And just on the right-hand side, it provides some pretty staggering statistics that help show you how important a program like Bridge to Health really is. 40% with chronic illnesses do not get the necessary dental care they need. 50% of those individuals seek the dental care they need, only 50%. And 20% reduction in medical claim costs when individuals with chronic illness get preferred dental care. So, which is pretty remarkable. The next slide talks a little bit about just some dental facts for you. Approximately 80% of all submitted claims are for preventive, diagnostic, and minor restorative procedures, including amalgam and composite fillings, which is a pretty high percentage. So we like to encourage members to go out and get their preventive and preventive visits on an annual basis and go in network if they can. 80% of members have less than $500 in dental expenses annually, which is amazing when you think about it. If 80% are using less than $500, you have to kind of ask yourself, why then are we offering such huge or large annual max plans, or why would an employer want such a large annual max plan and pay more when 80% of their members are receiving using less than $500 in dental expenses? So it really does make you think about what type of plan to offer. Second or third bullet point, only 65% of members have at least one preventive and diagnostic claim in a given year. Far less have a second cleaning. Therefore, we have a great opportunity to impact member behavior with strategic plan designs. Only 10% of all submitted claim procedures are for oral surgery, endodontics, and periodontic services, and the national average cost for root canals and porcelain crown fused to noble metal at 90th percentile of UCR is about $1,800. The cost in Des Moines is about $1,970. UHC's national average network discount is 30.8%, and 50.7% of all claims are paid to in-network providers nationally. And the next slide goes right into our vision solutions, our vision plans. And vision plans are definitely a great way to add value to a group's benefit portfolio by helping the employees save more money with their vision expenses and by adding more flexibility and choice. UHC's vision and dental plans, as I mentioned, received that J.D. Power Award for highest in customer satisfaction, so that's fantastic. But we really, with our vision plans, we take a patient-centered approach, which gives the members a lot of choice to choose between a private practice or a retail provider, broad provider access, and then they get a better member value. And an example is if they really are focused on wanting to go to a retail provider, we have some of the largest retail providers, which is the next slide. I'm getting ahead of myself. Some of the largest retail providers in the nation, and I'll get to that in a moment. Vision problems among adults age 40 plus cost an estimated $8 billion in lost productivity annually, and eye care providers can detect and report early warning signs of 23 chronic conditions. That's why the integrated vision care is at a low cost, accessible benefit for improving eye health and overall health. And just to take a moment, a little personal story related to the vision plan that I wanted to share with you is my niece actually really benefited from having the UHC vision insurance in that she went in for her eye exam, and because they have to write down the code as far as any diagnosis, they were able to identify that she, through her vision exam, and recommend that she go in to see her physician, they identified that she actually had diabetes. And so she actually has received outreach and has had a case manager providing her with a lot of the resources she needs, because again, she's just a college student. She, that's pretty big to learn you have diabetes when you're 19 years old, and it's gone extremely well, very smooth. She's doing excellent at college, but it just goes to show you that having a bridge to health program can really make a difference when you just by identifying a chronic condition like that. Next slide. Provider access and choice with our vision plans. As I mentioned, we have a national network, over 64,000 access points, both private practice and retail providers. I mentioned that a few times, but the important thing is to know that we have more than 100 national and local retail brands. I've mentioned before, on average, 99% of UHC Vision members in major markets have access to a provider within 2 miles. And that, again, helps with the provider or the member satisfaction. Some of the major retail providers are in our network, which include Walmart, VisionWorks, Costco, America's Best, Shopco, just to name a few. The next slide goes into another excellent financial protection product that we have to offer, which is Critical Illness Protection Plan. And the Critical Illness Plan provides members and the financial and emotional support when they need it most. The key strategy, the reason why people introduce a critical illness plan is that it goes very nicely with high deductible medical plans or to mitigate other large out-of-pocket expenses. Our critical illness plan helps financial hardship due to a critical illness. It offers a valuable lump sum benefit upon diagnosis of 13 major illnesses, and it pays the benefits in each of the 3 categories, which would be cancer, cardiovascular, or other critical illnesses. So basically with our critical illness plan, we offer a triple benefit, which is outstanding. Out in the marketplace, when we developed this, our critical illness and accident plans, our product development area did a fantastic job really looking at the competitors, what type of plans are out there, what's needed, and just the fact that we offer a triple benefit in each of the 3 categories potentially is a differentiator for our critical illness plans. And another differentiator is that we have a guarantee issue for employees and for their dependents. Also, critical illness is one of the products that we do have Bridge to Health with as well. And we, as you can see, I won't go through every single statistic, but again, there's pretty staggering statistics on the slide. Every 40 seconds, someone has a stroke. Every 34 seconds, someone has a heart attack. So you can really see how these critical illness plans, they've really been gaining popularity with the medical plans. And the next slide is the accident protection plan that we have to offer. And accident protection plans, as more employees shift the cost of benefits to employers shift the cost of benefits to employees, new approaches such as high deductible and consumer-driven health plans are becoming more common. And accident protection is another cost-effective way to help fill financial gaps and provide extra peace of mind. And that's, again, why we develop both critical illness and accident protection plans kind of at the same time, because oftentimes if you're going to show a client the critical illness plan, we often recommend that you also show them an accident protection plan at the same time. Most of the time they sell together and they work very well together. But accident protection plans help with those unexpected out-of-pocket expenses. And again, it's part of the Bridge to Health program. Next slide is talks about our life plans, life solutions. Again, supporting the financial well-being and peace of mind for our members. The life and disability plans offer more than just a payment of a life claim after a loss. We also actually support the financial and emotional well-being of the employees and their surviving beneficiaries. We're here to help beneficiaries plan for coping with a terminal illness or the loss of a loved one. So we do this through many of our value-added services. We offer travel assistance, will and trust preparation, grief counseling and beneficiary services. We have a wealth management account within our for our life plans. But as you can see, and those are at no additional cost to beneficiary. Will and trust prep is, you know, there can be an additional cost if they actually have someone, you know, one of the attorneys write and do additional services, but in general, these are at no additional cost for the basic services. Our life plans have flexible funding and plan design options, and just as you notice at the bottom, the average cost of a funeral today is more than $6,000. So just having the life insurance can alleviate some of those significant expenses at a vulnerable time. Disability solutions. We offer some excellent short-term and long-term disability plans, returning employees to work faster while promoting productive lifestyles. And we have flexible plan options with our disability plans to help meet the needs of the employers and members. Some of the statistics on this slide: U.S. employers lose over 125 million workdays to FMLA and short-term disabilities each year. So it just shows how important these plans can be for an employer. Our Bridge to Health program showed a 13% reduction in disability claim duration, and that is a very significant percentage. That right there oftentimes will, just that 13% reduction in cost can oftentimes it gets the employer right away they want to quote. So it's worth it to have them look at the plans with seeing that type of a reduction in disability claim duration. And then the cost to the employer or member for participating in the Bridge to Health Integrated Disability or FMLA program is zero. The Bridge to Health program is a program that the employer can just opt into if they have our disability plans, and we just have them fill out an opt-in form and answer a few questions, and then we can actually set the whole thing up for them at no cost. And then just at the end, or the bottom of the slide, identifying a medical condition early and getting a member the education and support he or she needs could be the difference between a few days of missed work and a prolonged period of disability, directly impacting your bottom line. So that's a great message to share to your employer groups that you work with. And the next slide is Bridge to Health. I mentioned that I would be talking quite a bit about Bridge to Health, and that's it's exactly what our whole deck is about, because it ties in all of our specialty products to this program. With Bridge to Health, we identify high-risk members and communicate ways that they can engage in better health. We identify members at risk with chronic conditions. We use dental eligibility and claim data with this program. Members who are not engaged in practices to manage their health, we try to engage them. We help track their progress, and that can make a big difference for both the employer and employee. We monitor the impact of care. We adjust benefits and programs to promote the best outcomes. And we encourage better health decisions with the members that we reach out to. So again, enhance the benefits, remove barriers, proactive outreach, and health and wellness tips and education. So as you can see, the members are getting a lot with this program, the ones that actually need it and are at high risk. Next slide. And the chronic condition categories that we look at, our eye care providers are instructed to include diagnosis codes for chronic conditions on claims as appropriate, and just some of the top chronic conditions would be diabetes, hypertension, high cholesterol, and vascular disease. And then there's a number of others that you can see. The next slide just shows you each of the specialty product lines and what the criteria is as far as how many employees an employer would have to get the Bridge to Health program included. For dental, The Bridge to Health is offered for 100 plus employees, so that would be key accounts. For Vision, 100 plus employees, key accounts. For Disability and FMLA, it's 2 to almost 3,000 employees. And for Critical Illness and Accident, it's 51 plus. So it does vary within each product line, but that we're hoping that over time we're very optimistic that we'll be able to offer this down for all product lines, at least down to 51 plus in the near future. Our claims data shows that on average, individuals with chronic illness who receive regular dental care have annual medical claims of $1,500 less than those who do not. Typically, 13 to 23% of a client's members have one or more of the 6 conditions included in the reminder program. So it really shows that it can be very beneficial to any employer. Our reminder phone calls have been shown to improve exam adherence by 50% versus 3% for a postcard program. So that's pretty significant. Data shows that our integrated approach helps reduce the duration of disability claims by more than 13%, which I mentioned in the previous slide. And when a member files a qualified critical illness or accident claim, he or she is automatically receives coordinated outreach and support. So that's kind of automatic with those type of plans. And the next slide, we go right into our package savings program for our specialty lines of coverage for groups with 100 to 3,000 eligible employees. And you're probably all very familiar with this, but I just thought these slides would be a nice reminder of the type of savings you get when you bundle specialty products with the medical. When a company purchases medical coverage and they add one line of the following specialty products, dental, vision, life, or short-term disability, they would get a $5 credit off of their medical bill, which is for 1 year. And then as you can see, if they add 2 lines of the following specialty benefits, they'd get $10, and it goes up by $5 each line you add. So it's available to all new or existing medical and specialty businesses, 100 to 3,000 total. And again, this is for 1 year on the key account side. And then for ASO, for 1 line it's $1, 2 lines $2, 3 lines $3 savings per employee per month. We also offer package savings for groups 2 to 99 eligible employees, and for 2 to 99 eligibles, if they have medical and they add a dental line, they would receive a $3 credit per employee per month off of their medical bill. Vision is $2, life is $1, short-term disability $1, and so on. And the important thing with this 2 to 99 segment is that it's perpetual, so it continues year after year, as long as they keep the specialty line with us. The next slide talks about the administration made simple and for members. And with our specialty lines, we have one website, myuhc.com, where a member can directly access our dental website or our vision website, which is fantastic. So it's all integrated, and our websites are extremely robust with all of their claims information, benefit information, provider network information, a wealth of information on wellness and education. We have a dental treatment cost calculator that can help them, calculate the cost of a specific procedure, and on and on. I'm sure you're familiar with the websites, but that can make a big difference, just simplifying the administration for the members. We have one account management team with broad expertise. We've gone to kind of a generalist model where you can contact your SAE, strategic account executive, or your renewal account coordinator for 51 to 99, and they're going to have a broad expertise all across from medical to ancillary now. and then they can reach out to me if they have, we have to answer specific questions that are more complex, or if we want to do any conference call with a specific employer group that's on the fence, they will loop me in to join that call if you'd like and answer all their questions on specialty. So one point of contact, quick and accurate responses, and then ease for employers, single vendor solution for them. We hear that all the time. They want one carrier that can, handle all their products. It's going to ease their renewals. They'll get discounts on their renewals based on bundling the products. Enrollment, e-services online, all of that makes the administration a lot simpler. And with 2 to 99, they'll have one bill, one implementation process, again, an online portal called e-services, and so forth. Next slide. So the top 10, or top, not top 10, but top reasons to consider UHC ancillary is we are one of a few carriers that can offer the complete package of, and bundle all the ancillary products together. One platform for medical and ancillary on Prime if it's small business, or UNET if it's key account. We also offer package savings credits, as I mentioned. Another reason is one bill, one enrollment file, one account management team, one online administrative tool for all products. So basically we allow a more streamlined administration for you and implementation. We are a top 10 ancillary carrier. We're a $2 billion ancillary company that insures 7 million dental members, 19 million vision members, and 1.5 million life and disability plan members. We are UHC is a top 5 medical carrier, provides products and services to more than 70 million Americans, and our pharmaceutical management program provides a more affordable access to prescription medications for 13 million people. And lastly, we have a very competitive broker compensation program, which includes monthly commissions, ancillary broker bonus program, and ancillary modifier and quarterly medical bonus for groups with 2 to 99 eligible employees. So that's the presentation I have on dental, vision, life, disability, critical illness, and accident. Does anyone have any questions?
Hey, Janet, real quick, I'm going to dive in as Lynn is kind of going back out to the group online. I'm going to suggest this, and as I always have these discussions, and I think the key thing, or questions I always want to come to is, one, why does it matter? Why is it important? Which I think is really the conversation that Janet was trying to bring through. And then I think the other thing that is, because honestly it's why Janet and I are here, is what questions can we answer for you guys? What can we do to earn the opportunity to quote your business? Because it's as simple as that. Our objective today is, which you guys know, is our objective is to sell our product and to make it make sense. I think from a pricing perspective and a value perspective, I was just talking with Lynn a little bit, and Jan and I just had a conference call early this morning. Our objective tied to, especially from a RFP quoting perspective, is to be as simple and as quick as we possibly can be, similar to how we are on medical. And tied to that medical comment I just made, people will often tell me, well, Mike, we think you guys are a medical carrier and you're dabbling in specialty. When I look at the billions of dollars, when I think about revenue lines, when it comes to UnitedHealth Group, clearly the billions of dollars we've got in specialty, I would suggest, is stating that we're not dabbling. To that also point, we know that we have to be as good as, if not even better than, the other solo line specialty carriers. We think we've got something different to sell and talk about. The reality is, if I know you're out there trying to get a $25,000 life policy, and it takes me, I'm making this up, 10 days to get you a number, will that be a problem? We know that we have to be as nimble as they are. We think we have that coming up, and or if not already today, in the very short term, will be there. From an education perspective, we've taken and are currently taking a broader effort to make sure our staff is educated, so that the experience that you would have working with us on medical and dental and vision, et cetera, would be as good as it would be as if it was just a medical only, which is really kind of why I've asked Janet to come out to the marketplace and be on the call today, to really show that we've got a team and let you hear the voice of the team, and really make a simple ask. Give us an opportunity to make it make sense from a product value perspective, and then have package savings apply on top of having a competitive set of rates as we look at a medical and dental and vision, et cetera. So that's really the objective that we've got. One, again, make sure you guys understand the why part, why this matters, and then two, my blunt and simple question is, what can we do to earn the opportunity to quote the business, and then have further discussions.
Well, thanks, Mike and Janet. What I'd like to do is invite any of the agents that are on the call to type in a question, and we'll field those live now before we wrap up. And as a reminder, this call is being recorded. It'll be out on our website. We try to get them on during the afternoon, but it might be early tomorrow morning until we get it out there. So we'll have a copy of the presentation. And maybe, Mike, you could just add a note here while we're waiting for those to type. I don't have any questions right now, but I'm waiting for you guys to type in your question. Maybe just give them a little piece about what's going to happen at 1:30 this afternoon.
Absolutely.
And what we're going to be talking about.
Thanks, Lynn. The secondary discussion, or the second discussion we've got today, is really kind of walking through, just again, a review, a reminder of our full product portfolio on the medical side of things. So we're going to go through things ranging from network to product to systems, meaning whether it's UHC proper or Heritage, the former John Deere Health, which is really kind of hard to say because it's been, what, 8, almost 9 years since that acquisition occurred. To really go through the value proposition, again, we believe and feel we represent on the medical side of things, that really goes right in line with what we believe we offer when it comes to specialty benefits. So, probably about an hour and 15-minute conversation. If you guys have a bunch of questions, we can go longer. So, wanted to just make sure we retouch on that one as we come into what we're already expecting to be a very busy Q3 and Q4. I'm already seeing my volume, literally my uptick, my volume for August 1 and 9/1 business is multiplying dramatically, especially right now, say in that 51 to 99 market space. I know that some carriers have adjusted their base level, and so we're seeing an uptick in renewals from our competitor friends in the marketplace. And right now we are seeing huge opportunity from a medical and specialty. So look forward to any questions and working with you guys.
And I guess our perspective here at KHI is, as you guys know, we're here to serve the client and to propose what we have in the market available to us. And in the group space, of course, our 3 main carrier partners, UHC, Aetna, Coventry, and Blue Cross. And you need to know what those are. If we get you a quote and it comes back and UHC's rates are smoking hot, you need to know how to describe what that product is, because your client's going to be asking you about it if they haven't had them before. And so we just really encourage you guys to get to know these products. And so from 1:30 to 2:30 this afternoon is our afternoon webinar today for UHC on their products. And if you can't make it, again, we'll be recording it. It'll be on our website. But our full expectation is that you understand what's in the marketplace, so that when rates come out and or these products, I mean, I think what they've talked about here today with the specialty products, I'm not seeing anything as robust as what UHC's put together. And then I was just talking to Mike about pricing, and he said, work with us. And that's one of the things, I guess, that we can do to help you. And we get to Mike and look at the rating and the pricing and where do we need to be, et cetera. Because certainly when they've offered all these products together, and on top of the medical, they have some little bit of flexibility there. Did I say that right?
Absolutely. Right on. No, I mean, we mentioned the idea of whole case underwriting. Small group is a little bit different than the 100+ or 500+ life groups, which we think about that. We're really looking at revenue lines when it comes to those larger cases. We do that similarly, though, in small business where, Janet and I work together on a frequent basis on if I need, 5%, 10% off my base rate when it comes to my dental line or my vision line, we'll get that if we need to get that to write the business, and then package savings applies on top of that. So we're trying to make this thing, one, really quick and efficient, and 2, make sure that you guys understand the questions, the answers that you need to have to feel comfortable talking about the product.
I don't see any questions from you guys. You can raise a hand as well if you have a microphone or you're on your telephone, and you can unmute yourself. I can unmute you so we can hear you if you want to ask a question live. Otherwise, type in a question. And I'm still not seeing
questions. Mike and I have answered those questions. So.
Nice thorough job there, Janet. Okay. All right. Well, listen, Janet, thank you so much from Minneapolis. And
my pleasure.
Go Twins, right? Go Twins.
Absolutely. They're doing great.
All right. Good deal. And Mike, thank you as always. And thank you, agents that are on the phone call today. And we'll look forward to hearing from some of you hopefully this afternoon, or usually on our Mondays for our training calls. So thanks so much. Have a great day. We'll talk to you soon. Bye-bye.